A word about BMI. Overweight and obesity are defined as abnormal or excessive fat accumulation that presents a risk to health. A crude population measure of obesity is the body mass index, or BMI, a person's weight in kilograms divided by the square of his or her height in meters. Body mass index, or BMI, is one of the measures used to assess a child's growth and development. BMI is age and sex specific and is expressed as a percentile or Z-score. BMI for age growth charts have been developed by various agencies such as the World Health Organization and Center for Disease Control. Although measuring BMI is recommended in clinical practice, how this information is used, interpreted, and communicated to patients and their families is critically important. Growth charts are a fantastic visual tool for helping patients and parents understand their growth. A growth curve with an appropriate BMI curve should be created once measured height and weight and calculated BMI are known. Historical measurements are useful in order to get a sense of weight and height trajectories over time. Growth curves can be powerful storytellers, and paying close attention to time periods when trajectories may have changed can provide critical information regarding potential root causes of obesity. An assessment of a child whose BMI percentile has been stable for most of their life will be different than one whose BMI percentile has been increasing or decreasing over time. According to the World Health Organization, obesity is defined as a BMI over the 97th percentile, and severe obesity is defined as BMI over the 99.9th percentile. When using CDC curves, obesity is defined as a BMI over the 95th percentile, and severe obesity is defined as BMI over the 99th percentile. The Canadian Pediatric Society recommends the WHO charts be used as the growth standard. While useful, BMI can be a poor marker of overall health. Risk associated with obesity is mediated through lifestyle behaviors, not BMI. A large population-based study of over 11,000 adults looked at the association between mortality and healthy lifestyle habits, including eating 5 or more fruits and vegetables daily, exercising regularly, consuming alcohol in moderation, and not smoking. The participants were stratified by BMI. Those with obesity with no evaluated healthy habits had a higher risk of mortality than their lean counterparts. The more healthy habits an individual had, the lower the risk for mortality. What may surprise you is that those with obesity who had all 5 good habits actually had no higher of a risk for mortality than their lean counterparts. According to this study, healthy behaviors better predict mortality than BMI. So if BMI is a poor marker of risk, how do we assess obesity risk? One method is to use the Edmonton Obesity Staging System for Pediatrics, or EOSP. EOSP is a quick and easy clinical staging system which groups children according to severity of related comorbidities and barriers to weight management on a scale from 0 to 3. This system has the potential to provide both clinical and prognostic information and was adapted from the adult tool, which was found to be predictive of mortality and morbidity independent of BMI, with clear separation of survival curves. To learn more about EOSP, check it out in the 5 A's for Pediatric Obesity Management Toolkit. Measurement and communication of BMI must be done carefully and sensitively. Many healthcare professionals, parents, and youth have the false belief that stigma and shame will motivate people to lose weight. Stigma and shame, in fact, contribute to behaviors such as binge and emotional eating, social isolation, avoidance of healthcare, decreased physical activity, lower quality of life, and is a barrier to engaging in health-promoting behaviors. Many patients with overweight and obesity have reported difficult experiences visiting doctors and other healthcare professionals. Sensitive information and weighing procedures include measuring weight in a private location that protects confidentiality, recording the patient's weight without judgment or comments, and asking patients if they'd like to know their results. In conclusion, while BMI growth charts are useful tools, the EOSP is a better way to assess obesity risk. Obesity management requires communication and interaction with your patients in a sensitive and caring manner to help reduce stigma and shame around weight. Be sure to watch the 5 A's of Obesity. Ask next.